Hello, and welcome to Healthy Living. I'm Dr. Donald Pelto, and today we're going to talk about ankle pain and the different problems that can happen in your ankle. Specifically, I want to talk about ankle sprains, ankle arthritis, a condition called tarsal tunnel syndrome, and also something that's a little bit more rare called avascular necrosis. And as you can see, inside of the ankle joint, there can be a lot of different problems that can happen inside, and this is just a couple of them that are more common. There are a lot of other types of problems, and this isn't to replace any type of medical treatment, but it's to give you a little bit better understanding about ankles and what are some of the ways you can treat it and even find out what you have going on in your ankle. Let's start with one of the most common here, an ankle sprain. Ankle sprains are very typical for people that are athletes. They can have what we call a lateral ankle sprain, which is kind of spraining the outside of the ankle. This can happen if you're in basketball or doing gymnastics or any other type of an activity where you could sprain your ankle. And that can be problematic because when you twist or you sprain your ankle, it can cause a bone break, it can cause another type of a problem. It can cause the ligaments that are on the side of the ankle, these ligaments right here, they can be either partially torn or fully torn. And depending on how bad the injury is, what tends to happen and the way the anatomy works is first the ligaments can get torn, and then there are some tendons, then the tendons can get injured, and then after that, then the bone can break. It's usually a process. The bone usually doesn't break until these other things that can happen, unless it's a very abrupt type of an injury to the ankle. There are other types of ankle injuries in the inside or the medial type of the medial side of the ankle, and we'll talk about that a little bit later when we'll talk about a tarsal tunnel syndrome. With ankle injuries or ankle sprains, it should be evaluated by a doctor. If there is a torn ligament, really depending on the type of the ligament, it may be treated with a cast or a walking boot or just rest, and it can take a number of months for the swelling to go down. And the problem many times that I see in the office is people come in and they've had frequent ankle sprains. They've had many sprains when they were in childhood, and their ankles, they say, they kind of give out on them. And these are the types of ankles that may need to be repaired, or something can happen inside of the bone, and we'll look at a little bit of the anatomy that can happen there. So these types of things can happen, and if you had a really bad ankle sprain, it should be evaluated, but we'll go over some of the treatment options for an ankle sprain. Next, we're going to look at ankle arthritis. Ankle arthritis can be caused by having a foot that's very flat and having kind of the position change of the ankle joint. It can happen because of trauma, maybe a car accident or other type of an injury. It can also be caused by frequent ankle sprains. If you have a lot of ankle sprains, what can happen in this bone right here, you can see it in red, is called the talus. And in the talus, you can get something called a talar dome lesion, or something inside of the talus from constant kind of shifting back and forth. Here's another example of a talar dome injury right here. And then what can happen to the cartilage is that if there's a lot of repetitive trauma in the ankle, you can develop arthritis in the ankle. And sometimes if this arthritis is painful, you may need to have a cortisone injection, or you may need to have some other type of treatment. And one of the most common types of treatments is to reduce the movement. If you have arthritis and you reduce the movement, it's going to feel better. Basically, if you use crutches or a cast or you put a brace on, the less that joint moves, the less pain you're going to have. But that's always it's not always practical for everyone. So that's a little bit about ankle arthritis. Next, we're going to talk about on the inside of the ankle. So the outside of the ankle is where a lot of the sprains are. On the inside of the ankle, what can happen is something called tarsal tunnel syndrome. So there is a little retinaculum, which is kind of like a ligament that's on the side of your ankle, on the inside, and there are different tendons in here, nerves, arteries, within this area on the side of the ankle. And what can happen is that this can become swollen, whether it be from the muscle here, or some type of an injury, or a very flat foot. And this can put a lot of stress and strain or pressure on the nerve. And people can develop numbness or tingling around the inside of the ankle that can become problematic on this nerve called the tibial nerve. And one of the treatment options here is something called a tarsal tunnel release, where you actually cut through that retinaculum or that ligament there to free it up so things can feel a little bit better. You can also try cortisone injection and some other types of treatments. And orthotics can be helpful, especially if there's a lot of pronation or a lot of flattening. You can see here, the flattening right here is going to put a lot of strain on those tendons on the inside. And by putting an orthotic in the shoe, you can see that it's going to help straighten out the ankle in that area. And the last area we want to talk about, it's not all that common. You may not even be familiar with some of these words, but I'll kind of explain it. Avascular, so vascular would mean blood flow. A is the absence, so the absence of blood flow, and that can cause necrosis or injury or damage to the bone in that area. So avascular necrosis can happen after chronic or really frequent injury to this talus. So this talus bone is right here, which is right underneath. This is your ankle joint. This is the tibia, the fibula, and the talus. And this can become injured inside from chronic injury. And you can see here how this lights up with this MRI. And avascular necrosis is really bad arthritis, for lack of a better term, inside of the bone that's not really healing, that's very inflamed, very painful. It sometimes can calm down, but sometimes it can't. And this can actually, this type of injury to that area can be caused by a very bad sprain, a very bad fracture, or a very bad traumatic experience where you lose blood flow to that area of the bone, and that bone can die. And if that bone dies, if it's painful, in most cases it is, depending on the pain, you may need some type of a surgery. Okay? We're not going to go through all of the treatments, but some of the most common treatments that you can try before you come into the office, we'll go over some of those. Okay? I like to divide it into categories. And basically, I recommend doing something from each category to make your foot feel a little bit better if you have ankle injury. So the first thing you have to do an examination. This should be done by a doctor to determine is there any ligamentous laxity in the ankle joint? Does the joint move more than it should? Is there pain? Does it feel like it's on the outside? Does it feel like it's on the inside? This should be evaluated along with an X-ray. Sometimes you could do an MRI or even an ultrasound to evaluate everything that's going on. And sometimes you need to look at the X-ray or even an MRI to see if there's something like the avascular necrosis, or you might not be able to see that talar dome injury that we talked about. And ankle sprains you can't see on an X-ray. An ultrasound is better, or an MRI is better to evaluate those or the tendons around that area. So the initial exam you should do, and then to reduce the inflammation. There's a lot of things to reduce inflammation. Inflammation is the reason for the pain. The first thing I recommend is some type of a cold therapy. That can either be icing on the area, or you can do a contrast bath. Everyone wonders how long you should ice. 5 to 10 minutes. Take a bag of vegetables, put it on it, and then kind of rotate it once, every hour or so. You can also do contrast baths where you do hot and then cold. What that does is that vasodilates or opens up the blood vessels, and then vasoconstricts them or crimps them down, and that happens in the ankle wherever you're putting the contrast bath. So it'll swell up and then it'll calm down, swell up, calm down. That can help with a lot of that inflammation that you're having. Now, if this is ineffective or any of these are not that effective over a long period of time, you probably should see a doctor about this. NSAIDs are anti-inflammatories. If you're able to take those, if your doctor will allow you, that can be helpful. Taking them at a therapeutic dose is recommended. Cortisone injections. I find a lot of areas, at least to determine the problem, it can be very helpful. I explain that cortisone injections are therapeutic, but they're also diagnostic. And what I mean by that is therapeutic, and it can many times help some of the pain, but if you're only doing it to help the pain, it's not going to last forever, because a cortisone doesn't last forever. Everyone wonders, how long does a cortisone last? We usually say it can last from a couple of weeks to 2 or 3 months. And for example, that arthritis we talked about in the ankle joint, if you have really bad arthritis, you can do a cortisone injection. It'll make it feel better, but once the cortisone wears off, the pain is still there because you're not fixing the problem of the arthritis. You can do that for that. Cortisone doesn't work all that well for ankle sprains. For an avascular necrosis, it can make it feel a little bit better, but it's not going to really resolve the issue with that either. Okay? Or the tarsal tunnel. Tarsal tunnel might help a little bit to reduce some of the inflammation. If the inflammation is pushing on the nerve, you may want to do an ultrasound-guided cortisone injection in there, being very careful of some of the other anatomy that's in that area. So cortisone injections can help. And what I said, they're therapeutic because they can take away the pain, but they're also diagnostic because the ankle and in the middle of the foot can have some overlap in terms of the conditions. And if you, for example, if you inject the ankle joint and the pain doesn't go away, the ankle probably isn't the problem. It might be one of the joints underneath there, like the subtalar joint or one of the other joints in the foot. Whereas if you do it in the ankle, and all the pain goes away and that's it, then you could consider maybe a brace to not allow the ankle to move. That might help some of the symptoms. A walking boot, basically a walking boot just restricts the movement. I find a walking boot is very effective and to reduce the pain. One thing that's kind of unique that when people come into our office, if you look here on this picture, they have this little thing that's strapped onto the other foot. If you have a walking boot and you find that your posture is off or your hips dropping and you're off level, there's something called an even up. There are probably other names for it, but this is something that you put on the other shoe to lift it up a little bit so it's the same height, so you don't have what we call a limb length discrepancy. Another thing that you can do, just a tip, if you have some ankle pain or you're wearing one of these walking boots, you can also just wear a higher heel shoe or a work boot with a heel on it on the other side to level you out. And then if you're really having a lot of pain, people, especially after what we call an acute ankle sprain or an ankle sprain that just happened, if it's hurting you a lot, you're probably going to be either in a cast or just have crutches and not putting any pressure on there. There are some ankle stirrups. What I find when people come in from the emergency room, they get one of these stirrups. It basically looks like two hard things on the side that are kind of plastic with a kind of elastic brace around it to stabilize it. These stirrups are made to be worn temporarily to hold things in place, but you really have to be careful in making sure, because if you have a fracture or a broken ankle or a broken bone, this needs to be evaluated. Many times ankle sprains that are really bad could actually be have a bone break that can happen either in the foot or in the ankle. And then finally, to reduce inflammation, sometimes if you have a chronic issue with one of the tendons or the ligaments, sometimes shockwave therapy can work. Shockwave is something new that we have for an area that has a chronic injury or inflammation. You can hit the area and increase the good blood flow to the area to help bring the healing components. There are a lot of other types of treatments to reduce inflammation, but these are just a few that we wanted to talk about. So reducing inflammation is the first thing you should do. This can, if you reduce the inflammation and the swelling, normally the pain reduces for you. Next thing I want to talk about is reducing the tightness. If you're having pain in the ankle, a lot of times what happens is the muscles around the ankle, like the Achilles tendon or the peroneal tendons on the side or the posterior tibial tendon on the inside, all these tendons around the ankle tend to tighten up, or we call it, they guard. They can be guarded, either that on the foot, and they don't move as well. And this can make you walk differently, make you limp, and even after your ankle sprain feels better, these other muscles might be tight. So I really like trigger point tools, grid foam rolling, and some types of stretching exercises. This can be helpful for you if you have one of these conditions. Once again, you should always seek out attention, but a lot of times what's missing is loosening up a lot of these other muscles that are having to kind of change the way that they're working because of an injury that you might be having. So here are some of the tools that we use. Here's a trigger point roller, foam roller, and this is some stretching exercises. Next, I want to talk about physical therapy. I think physical therapy is very important for a lot of these conditions, especially with ankle sprains. If you can't get better on your own, or you may be what we call guarding or not wanting to walk, or you're limping and you need help, because you need to keep it active, you need to keep it moving if there's no obvious tear in there that needs to be totally cast and immobilized. But physical therapy can be very helpful. And you have to really be patient. With ankle sprains especially, it takes a long time. It can take months and months before you start to feel better. And that can be challenging, especially if you're a very active athlete. Wrapping things can help. There's different modalities that physical therapy can help with as well. Now, it's a little bit different when we're talking about avascular necrosis or arthritis or tarsal tunnel. There's not as much physical therapy can do for those types of things. They can help you maybe in the post-surgical recovery. They can try some things prior with taping and immobilizing the area. But those issues that are more bony or arthritic, they're difficult to resolve with physical therapy. Next, we'll talk about stabilizing the foot and the ankle. I put here stabilizing the ankle because we're talking about ankle injuries, but all the stability in our foot, it actually starts with in our ankle starts in our foot because that's the foundation. So if your foot is very flat like this, you can see how an orthotic, you see that line that goes, it straightens it out. That's the purpose of an orthotic. It's not to give it arch support. It's actually to support and realign the heel position. So it's aligned, your ankle joint then is aligned. If your foot's off like this, it's going to affect the ankle joint, as you can imagine. So when we talk about kind of progressively trying to stabilize your ankle or stabilizing your foot, the first aspect is supportive shoes. If you're having ankle pain, you probably shouldn't be in flip-flops. They're not giving you any support. Barefoot usually isn't recommended. A nice stable shoe. There are a lot of very good brands that have nice stability and that go up the side. A lot of people, they feel better with maybe even a high top or a work boot as well. That gives it more stability. The next step, if a nice stable shoe isn't enough, okay, then you could try an orthotic. An orthotic can help you to stabilize your foot, especially if you have chronic sprains. It can give you the additional support that you need so you're not constantly spraining your ankle. There are different modifications that can help to not allow you to sprain your foot, like a deep heel cup. Having a deep heel cup helps it not to twist the ankle as much. Going up from there would be then an ankle brace, and this is an example of one of these lace-up ankle braces here. You can see there are some laces here, and this goes up the side. This will give you additional support along that ankle region. It doesn't allow it to bend. And then even more would be an ankle foot orthotic. This is something that actually has an orthotic here on the bottom, has these little rivets, these things that go up the side that strap around the ankle, so it stabilizes not only your foot, but it stabilizes your ankle. And these are levels of severity in terms of giving you stability. And these may be necessary short-term, and these may be necessary long-term, really depending on your injury. If you have really bad arthritis and you want to stabilize it with an ankle foot orthotic, it may not move. But if it doesn't move and it feels great and you're not that active, that's good enough. But then the next step, if that doesn't work, you may need some type of a surgical intervention. And then surgery, it's really beyond the scope of this lecture to talk about surgery. There's a lot of different treatments for the ankle sprain. You could do an ankle stabilization. You could fix the tendons in there. You could do everything that's kind of needed. If there's avascular necrosis, there's different procedures. There's kind of like drilling that area out. You could fuse the ankle, whatever is needed for that. Or the tarsal tunnel, once again, there are some surgical treatments. That you should really talk to either your podiatrist or your foot and ankle surgeon for evaluation, the different surgical options. And then with my patients, I like to use something called an ankle pain checklist. And this is just something if you are dealing with ankle pain and you want to kind of check, well, have I tried everything that's a possibility for treating it? Some of the imaging things you may want to consider would be an X-ray or a diagnostic ultrasound or an MRI. Some of the traditional treatments to reduce inflammation, we talked about icing and anti-inflammatories. A cortisone injection. The reason I put 8 weeks here, I like to wait about 8 weeks before I do them. A walking boot, the shockwave therapy we talked about, and then reducing the tightness, stretching or foam rolling, physical therapy, stabilizing your ankle. We finished talking about kind of how they increase in terms of support. There are some advanced treatments that people are talking about these days. This may be obsolete in the future. We may not use it, but for now, we are using some of these treatments called amniotic tissue allograft therapy. And then if it's been over a year, either getting surgery or maybe a second opinion might be in store. So here are some treatment options for ankle pain, and if you'd like more information, please reach out to us here. Glad you're here for this episode of Healthy Living.